National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Naturopathic Doctor Jonathan Beatty, a health expert here at nationalnutrition.ca. One of the things that patients often present in my office with are eye infections. Now, there are a couple different types of eye infections people have. The main two types are viral and bacterial. And the easy way to tell them apart is typically a viral infection will have a clear, teary discharge that will be a little bit more fluid. Now, if the discharge starts to change color, it starts to go a little yellowy or greenish or even purulent like white, then you may actually end up having a bacterial infection. And it's good to identify that because the interventions for those two types of condition are going to be different, and the way in which they're transmitted is also a little bit different. And then of course the other type of thing that can lead to eye infections are allergies. So if you get a lot of seasonal allergies and your eyes get itchy and they start to water, if you're repeatedly rubbing them and touching them, there's a higher chance that you're going to introduce a virus or a bacteria to the eyeball, and thus you're going to give yourself a type of eye infection. So that's the other thing that you're going to want to take into account, especially if you get recurrent eye infections. Now, eye infections, they are annoying, they can be painful, but the big thing is if they're recurrent, if you keep getting them again and again and again, they can actually be quite damaging to the eye. So it's important if you do have them, get them evaluated, get them treated early. Now, some of the things you can do if you do have an eye infection, one of the classic remedies, especially for something like pink eye, is simply taking a tea bag, soaking it in a little warm water, wringing it out, and holding it over the eye. The tannins in it can help dry out some of the tears, and it can just help provide a little bit of relief while the pink eye resolves. Usually all you need are some simple saline or like tears type eye drops. They don't necessarily have to have any medication in them. They're literally just there for a rinse. The one thing you really want to make sure of though is that you're washing your hands all the time because pink eye is highly, highly contagious. It's easy for you to transmit it to somebody else, but also for your own health, it's easy for you to transmit it from one eye to the other. So if you start to develop pink eye in one eye, be very cognizant of how often you wash your hands and make sure if you ever touch the infected eye that you wash your hands before touching anything else because there's a good chance you'll transmit it to somebody else or to your other eye. Now, if you have a bacterial eye infection, it's good to get that evaluated, and then depending on the type of infection, there's a number of treatments you could look into. There's good research showing colloidal silver can actually be very beneficial. It can be diluted to make basically an eye drop, and silver is a natural antibiotic and antifungal, so it can help to treat different types of eye infections, and it's very, very safe to use. Now, in addition to that, certain herbs can be used topically as poultices. Often, basically, you would soak a tea bag with a herb like golden seal or some other type of antibiotic herb, wring that out, hold that over the eye, and sometimes those herbs will actually be enough to treat the bacterial infection. Or if it's persistent, you can go to your doctor, go to your eye doctor, and get an antibiotic eye drop if needed. Because of course, if the infection does persist, you can cause long-term damage to the eye. So you want to make sure that you treat it quickly and effectively. So I hope this has helped teach you a little bit about eye infections, how to identify the type you have, things you can do to help prevent them. And so if you found this video interesting, please subscribe to our channel. Any questions or comments can be posted below. And always remember, knowledge is health.